supply chains we work in are really about life and death.
The goal of any public health supply chain is to save lives.
Because ultimately, at the end of the day, it's all about ensuring these medicines are getting to where they need to get to.
Knowing that at the end of the day, you have helped to move a product into the hands, into the mouth, into the arm of someone who needs it.
Behind each product, you know that there are supply chain professionals.
The decisions we make have big impact, and we can help to change communities, and we can help to shift the entire world.
Doctors, nurses, pharmacists, midwives, lab technicians. These are the indispensable people who provide healthcare to billions of people. But in the background are the unsung heroes who work every day to make sure health providers and the women and girls, men and boys whom they serve have the medicines, vaccines, contraceptives, diagnostic tests, and other supplies they need. These are the storekeepers and truck drivers, the warehouse workers and procurement specialists. These are the supply chain people led by dedicated supply chain managers. This is their story, and it can be your story. Join us in a journey where we try to answer many of the questions you ask. What are supply chains, and why should I care? In this episode, you will be hearing from Wadah Hubayishi, Danish Refugees Council, Yemen; Jenny Froome, SAPEX; Carolyn Hart, JSI; Nora Quesada, JSI and FP 2030; Andrew Brown, IntraHealth International; Pam Steele, Pamela Steele Associates. They will walk us through the importance of supply chains and the critical role they play.
If you think of any product that you have, even the cup of coffee in front of you, it's really fascinating the trip that this product had to go to in order to reach your hands. So there were coffee beans growers, farmers, and who had to cultivate it, and then some companies who help mill those coffee beans, transport them to the nearest port, seaport, and then from there, larger transportation through ocean freights or containers took them halfway across the world to middle sellers, and then from there to distribution points, and then finally it reaches you.
It's a set of functions that have to take place that involve forecasting the requirements and arranging the actual logistics of shipment and delivery and storage along the way, and all the information that drives every one of those steps, and ideally ending with information about what gets used.
At the heart of the supply chain is a workforce composed of many different specialists, each doing her or his own part to produce, procure, ship, store, and distribute the products we need and use. Ministries of health around the world are increasingly recognizing the importance of these supply chain workers and managers, and are seeking skilled professionals to fill these roles.
People are absolutely vital to the supply chain process and the management of it.
Within a supply chain, there are a number of types of people that are really necessary to make the system work. You can have the regular staff that might be within a warehouse, might be driving trucks, they might be moving boxes, and really being part of that physical movement of the products through the system. The other group of people that are very important are supply chain managers. And in health supply chains, these might be at the national, district, or sub-district level, and have a responsibility over a number of distribution sites.
While all supply chains share common processes, making, buying, shipping, storing, transporting, public health and humanitarian supply chains are unique compared to those in the private sector. Commercial supply chains are based on making a profit at every step, so they focus on efficiency to keep costs low and performance high. In public health and humanitarian supply chains, Efficiency and costs are important, but the products are often free to the people who need them. So the only profit at the health center or humanitarian aid center is in the health and well-being of the people they serve.
Working in humanitarian, to be able to see how my contribution saves life gave me more fulfillment than perhaps working in places where perhaps one would earn six-figure salary, but you don't get the fulfillment. If one is looking to contribute to humanity, to making a difference, to reducing suffering, then humanitarian supply chain is the way.
In the health supply chain, my values are well aligned because health is so important for people. It's so important for the society as a whole. You cannot have economic growth if a society doesn't have access to health services. And health services make sense only if supplies, commodities, medicines are available to the people who need them the most.
But it's never easy. All supply chains struggle to overcome problems, as the COVID pandemic has shown. But public health and humanitarian supply chains face particular problems reaching people where they live, especially in remote areas. Poor roads, lack of electricity, lack of maintenance, along with too many workers who have not been adequately trained. And medicines and vaccines are especially vulnerable to damage from heat, sunlight, moisture, and even worse.
One of the other aspects about medicines is internationally there is a black market for falsified medicines. It's hard to imagine, but there is a group of organized crime that has it its main task to produce medicines that are fake and to distribute them around the world. People can steal things. In some countries, a particular course of antibiotics can be equivalent to 1 month's wages. So they're very valuable. Another is they can just be diverted from perhaps a Ministry of Health supply chain to a private supply chain for sale for the benefit of profit of some.
And this is where you can make a real difference. We need people like you to become supply chain managers and to understand these challenges, these risks. Using experience, using education and training, using data as much as possible to monitor the systems, create backup plans, and constantly adjust to make sure there are no stockouts and no losses in the system. When supply chains work well, nobody notices. When they fail, everyone notices. Because people's lives are at stake. Getting health products to people requires flexibility, creativity, and dedication. Every day.
Really, the daily miracle of getting products to people, especially in hard-to-reach locations, and especially at price points that they can access, it is a daily miracle. And I just love that characterization, especially when you apply it to the global health supply chain.
Are you ready to become a miracle worker? In this video, we have covered some important topics to remember. Nothing you buy, eat, or use gets to you by magic. Everything depends on supply chains. Supply chains vary widely depending on what product they need to deliver and where the products are going. Health products often depend on public supply chains that face many challenges. Getting health products to those in need can make the difference between life and death. To learn more about how you can get started in a career in supply chains, visit Laptop, the Logistics and Procurement Training Opportunities platform, to find over 650 learning opportunities from in-person and online training short courses to university supply chain programs and professional certification courses. Find us at rhsupplies.org/laptop.